we are.
Hello. Is it recording us?
Yes.
My name is Heather Richards. I've been a nurse for over 40 years, but lately I turned into yoga. Today is Halloween.
Happy Halloween. And my name is Jordan Mingrant, and I'll be interviewing Miss Heather today. So you said you're RN. How many years were you an RN before you went into traveling for the Navy?
All right. Well, I've done two kinds of traveling.
Okay.
I graduated with a bachelor's in nursing from the University of Northern Colorado in 1976.
Okay.
In 1977, I joined the Navy.
Oh, okay.
Okay. But I was in the Navy Reserves, and in the Navy Reserves, I worked for 3 years active duty, and then the rest of the time, for the rest of the 40 years, or about 35 years, it was the 1 weekend a month, 2 weeks out of the year, that type of thing. That's what reservists do.
Okay. All right. So, for the, so you mainly just did the traveling for the nurse, for the Navy, I should say?
No, there are, because there's been such a nursing shortage, traveling nurse companies are all over the place now.
Okay.
And I've worked for several different traveling nurse companies.
Okay.
And what they do is you sign up with them, and they say, well, we've got a job, like a job in Washington. I went to Washington State. And, you know, and I fill out all the paperwork. The company presents my paperwork to the hospital says, come on over, and then I work there.
Oh, okay. So my next question would be, which state did you stay the longest in since you were traveling?
Let's see. Longest in, that's a hard one. Probably Wisconsin. And those weren't travel nurse positions. I was working pediatric intensive care at that time in Green Bay, and then Marinette, that was Michigan. But anyway, let's see. Let's look at this. Let's look at my resume here, because that'll help me and help you. And my resume, I divided it up into psychiatric nursing and medical med-surg nursing. When I first became a nurse, it was kind of funny. I'm from Colorado, and I had been a ward clerk in a hospital in Colorado Springs. So when I got my bachelor's degree and became a nurse, I went back to that hospital and figured I'd get a job like that. And I didn't. They didn't want to hire new grads. But a little country hospital near Kansas was desperate for a nurse to do a 2-week vacation relief for another nurse that was going on vacation. So I signed up for that and went there, and I ended up working there for about a year in this little country hospital. They're called critical access hospitals. They still have these kind of hospitals in rural areas all over the country. 1 nurse a shift and 1 aide. And I would deliver babies. I worked in the ER. If you had somebody on a ventilator, we had med-surg patients. The 1 nurse did everything. Wow. It was an 18-bed hospital. There was also a nursing home attached, and I supervised the LPN that worked in the nursing home. If he had any problems, I would help him out. I did that for a little over a year, and then I was getting kind of bored because anything really critical in that little hospital got shipped to Denver or Colorado Springs. So I decided, and I was tired of the wheat and the grass and the horses and the cows and the flatness, so I decided to drive to Denver and see a Navy recruiter. I was supposed to interview with a Navy nurse, but she didn't show up. She was coming from Texas. I interviewed with an enlisted guy, and I'm like 23 years old. And he says, why do you want to join the Navy? How old are you?
I'm 21.
Okay. I said, because I want to live by the ocean and learn how to scuba dive. That's what I told him. And we spent about a half an hour discussing scuba diving around the world. He was a scuba diving fanatic that just been transferred to Denver. Now he's landlocked.
Yeah.
And I also had applied for a job in Guam. My brother was in the Air Force station in Guam. And so many months went by, and I hadn't heard from the Navy, and I didn't hear from Guam. And then about June or July the following year, I heard from both of them. They both wanted to hire me. But the Guam job was working in a nursery, and I do not like screaming babies. And part of that job in that first hospital was working in the nursery, because you're one nurse, you do everything. After you deliver the baby, you're taking care of them. So I went to the Navy, and I got stationed in San Diego. In San Diego, I worked neurosurgery and trauma. These are people that have been in car accidents, fallen off of cliffs, motorcycle accidents. A lot of them needed brain surgery. I worked neurosurgery and trauma for about a year, and then they transferred me to surgical intensive care. And this was back in 77, 78. We were doing open heart surgery then. The patients were in the ICU, and we were having a lot of success. It was a really cool job. I saw a lot of different critically surgical patients. And then I got married and got pregnant. And my husband got stationed in Hawaii, and I'm in San Diego, and I really wanted to have the baby wherever he was. So I resigned from my Navy commission, went to Hawaii, had my daughter in Hawaii, and then his ship got transferred to Norfolk, Virginia, totally the other end of the United States. And that's when I went into the reserves, where the reserves is you do a weekend a month and then 2 weeks out of the year. And so I retired from the Navy Reserves. It wasn't full-time Navy, it was Navy Reserves. And I did that for about 22 years. So whenever I had a civilian job, they always had to give me 1 weekend off a month and 2 weeks off the year to complete my reserve component. One time I went back to San Diego to do pediatric intensive care, and it was a 3-month Navy Reserve contract, so I was gone for quite some time. When the Navy calls up and said you need to come, you need to come. In the early 90s, Desert Storm broke out, and I was recalled to active duty. I was living in Virginia at that time, and I was back on active duty for over a year during Desert Storm. I didn't go to Saudi Arabia, but Portsmouth Naval Hospital in Virginia, it's a huge naval hospital. It like unloaded, all the nurses went to Saudi Arabia, so they needed to backfill the hospital with nurses from all over the United States. By then, I was doing psychiatric nursing, and I was the head nurse of a schizophrenia bipolar floor. My nursing career, what I've liked about it is I like psych, and I like med surg. So a lot of times I did psych jobs, and my resume, I did a lot of, when I'm applying for the psych job, they just want to read psych experience. They don't care about all my med surg. And when I apply for a med surg job, they don't care about the psych. But you know, every patient has psychological and medical components usually, so it's good to have both experience.
So that would like lead into my next question. Did you like being just like an RN, like how you said you had the time in the neurosurgeon and all that compared to like I guess reserves and doing that? Which one would you prefer? Like which one?
I think I liked being in the Navy better, mainly because my rank went up really high. I was a commander in the Navy, so people couldn't boss me around too much, and I could kind of figure out my own schedule, that type of thing. And the Navy hospitals are as advanced, if not more so, than regular military hospitals. I mean, regular civilian hospitals. They have a lot of funding, and you can imagine during, you know, if there's a war going on like the Saudi Arabia, we're getting, you know, people with really critical injuries being shipped all the way from Saudi Arabia to Portsmouth Naval. So
All right, and then so like what would be like kind of thing like a regular day of if you say you were when you were out in the Navy hospital compared to like the neurosurgeon.
Neurosurgery?
Yeah.
Okay, neurosurgery.
Like what would be the duties, like your hours, a typical shift?
Most nurses nowadays are doing 12-hour shifts, and the Navy was the same way, at least as the years went by. Because you do 12-hour shifts, you're usually working 3 12s a week, so that's 36 hours, and you're getting paid for 40. Which is kind of nice. When you work 12-hour shifts, you're usually doing 7 in the morning to 7 at night, or 7 at night to 7 in the morning. I chose to always work day shift. I did not want to work night shifts. Some nurses like night shifts. It's usually less medications, less doctors interfering with what you're trying to do, you know, because they've already made their rounds and seen patients during the day. No, some nurses like the night shift. I don't like the night shift because it really upsets your circadian rhythm. Once you work nights and then you get a day off and then you're sleeping during the day, and you know it's hard to sleep and hard to take care of kids and stuff like that. So 12-hour shifts is what most nurses are doing now. I'll tell you, one Navy job I had, you worked 7 12s in a row, but then you got
Oh, wow.
7 off, so you got a whole week off.
Oh, okay.
And then if you took a week of vacation, then you had 2
2
weeks
weeks
off.
off,
So
yeah.
that was kind of cool too.
Yeah.
You know, it just depends.
And then with how you said it would be difficult when your rhythm because of taking care of your children. Would you think did becoming a nurse make it hard for family? Because I've heard like some certain medical fields make it hard to have a family because of the long hours,
Mm-hmm.
especially with your husband also being in the military. Was that difficult or?
When we moved to Virginia initially from Hawaii after I had the baby, I told him I was only going to work part-time. I would not work full-time once I had this baby. And then I was lucky to have two really great babysitters within the neighborhood.
Mm-hmm.
So it worked out well. So I only worked a couple days a week, and by then I was doing psychiatric nursing, which was a lot less intense in a lot of ways.
Mm-hmm.
Less medications, don't have to worry about IVs, IV medications, not worried about taking people to CAT scan or x-ray or doing all those kinds of things. It's psychiatric nursing in a lot of ways is a lot easier, I felt. One thing I did do as psychiatric nursing is electroconvulsive therapy. When I was in the Navy, I was the only nurse that was trained in that.
Mm-hmm.
ECT is usually done in a recovery room in a surgery center, and it's done for people that are profoundly psychotic, and they're not really sure how it works, but causing a seizure to occur oftentimes helps them recover sooner. It's still being used.
So, because I know it's been a while since you have been a nurse, what was the average pay during that time that you were?
Oh, geez, that's a good question. I really have to ask my husband. I'd say between, near the end of my career, between about 80,000 a year, something like that.
And when did you retire?
Well, the traveling nursing pays you a lot more too.
Oh, okay.
My last traveling job was a couple years ago in Washington State. But that traveling job I didn't like at all. I signed up to work in a psych hospital, and it was a corporation that had 3 different psychiatric hospitals, and each one was about 40 miles apart from the other. So they would call me up at 4:30 in the morning to say, ooh, today you're going to the hospital in Everett,
Oh,
So we'd have to drive to Everett, and we'd do that for 12 hours. And then the next morning, they'd call me up again. Today they don't need you at Everett, they need you at blah, 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 And so every hospital was different.
Mm-hmm.
To be a traveling nurse, you need to kind of hit the deck running. You have to be able to orient quickly, and because they can't spend a lot of money for, usually when a new nurse comes to a hospital, she's going to be on orientation for 2 weeks to 4 weeks. You can't do that as a traveler because you're only there for 3 months. So you get like 1 day of computer training and, show you around the hospital and where stuff is, and then you're it. So this psych job was really difficult because the 3 hospitals were totally different staff, totally different patients, totally different unit setups. That was difficult. I didn't like that job.
So how would you say that these jobs affect you mentally? And was there a certain job that was worse? Because I know, like you've probably seen a lot of deaths and stuff. Like, how do you cope with that type of?
I've seen people die. Not a lot, but it happens. I don't remember ever being totally devastated or anything like that. I remember one patient, I was working in a nursing home, and she passed away, and I swear when they put her on the gurney and they were rolling her away, I really kind of hoped that she would just sit up in the gurney and be okay. You know what I mean? I remember thinking that, and then knowing that that's not going to happen, but thinking that. People die. It was hard. I did pediatric ICU for a long time, and that was really, really sad. If a baby died or a little kid died, that would be really hard.
Yeah.
But usually, oftentimes in those units, the nurses, there's a lot of camaraderie with the nurses, a lot of support and helping each other out. And of course, hospitals have chaplains, minister kind of people, and they're always somebody that you can talk to, and they're supportive of the staff. And anyway, I never felt really devastated that somebody died and went home sobbing and crying. I never had that happen.
Okay. And then my final question is, looking back on your whole career
Mhm.
of being an RN and a traveling nurse, if you could go back in time, would you ever change that decision of, getting that degree? Would you pursue something else?
That's a good question. No, I think I really enjoyed my nursing career. It gave me a lot of options. It allowed me to travel quite a bit, and I do like to travel. I think going in the Navy was a great decision. I now get retirement money from the Navy. I'm able to go to the VA hospital and get medical care really cheap. Yeah, I think it was great. I started working on a master's degree. I have a year of a master's degree because I was going to be a nurse practitioner, which is kind of like a doctor.
Yeah.
But after a year of going to school and stuff, I remembered I didn't really like to study very much. And number two, I like to travel too much. And back in those days, they didn't have traveling nurse practitioners. But nowadays, they do. They
Oh,
do.
okay.
So, had I pursued that, I guess I could have done that. But
Yeah.
it was good. The school, we went to Russia for 3 weeks.
Oh,
So that
wow.
was kind of a neat experience too, going to school. But one thing about being a nurse is you'll be a better mom and a better just human being because you know how the body works. You know when something needs to go to the doctor and when something doesn't, and I think that's really good knowledge to have. I really do.